now we will discuss the triangles of the neck. Okay, so I'll give you a brief intro. Let's just give you the simplest possible way to understand triangles of the neck. So here we have our mandible, right? At the very back we have a mastoid process and later joining to external occipital protuberance. Okay, then what we have here on the anterior side, what do we have? On the anterior side, we have anterior midline and lower border, which made by a clavicle, right? So this is a clavicle, and on the back of it, a posterior line, midline of our neck. Okay. So now let's just say let's just make out a triangle. We know the major muscle which divide a triangle is our SCM, right? This SCM muscle is dividing our triangles of the neck into an anterior triangle and the posterior triangle. Okay, so here this is a sternocleidomastoid muscle, also known as SCM. It has two values actually, right? This one attaches to a sternum, attaches to anterior part of clavicle and connected to mastoid. That's why it is sternocleidomastoid muscle. It is exterior external occipital protuberance. Okay. So now we have another bone in our body, especially here, which is hyoid bone. This is a hyoid bone. This is a mandible. Okay, and from here we have anterior value of digastric, which is connected into here we have digastric fossa. Okay, and here we have posterior value of digastric. So this is a digastric muscle, right? In a digastric muscle, what do we have? We have a digastric fossa, which we'll discuss again. Okay, don't worry about that. And there is another muscle we should not forget: omoid muscle. This is the anterior value of omoid, then there is the posterior value of omoid, superior inferior value of omoid, whatever you want to say. This is omohyoid, right? So now let's just divide our triangles. Okay, so at the back we also have here trapezius muscle. This is trapezius muscle. Okay, and so let's just divide it. This part, whatever is anterior to a sternocleidomastoid, this is anterior triangle, right? And whatever posterior to it, this is posterior triangle, right? So this is anterior triangle and this is posterior triangle. So let's just make it in a simplified line diagram. We will remember it as this: a simple inferior border of mandible. This is our anterior triangle, right? So this much is your inferior border of mandible, right? And this is mastoid, right? And this is our SCM, right? This is hyoid, right? And then the muscles. This is this one is posterior belly of digastric muscle. This is a anterior belly of digastric muscle, and from here it is omohyoid. This is trapezius, right? So this is clavicle, anterior midline, right? These are all the muscles we have. So let's just name all the triangles. This is submental triangle. Why? It is just below the mental point. It is just a chin area, the mental bone. Okay, the mental area, submental triangle. This is it. It is in between two digastric muscles. So it is digastric triangle, right? Then what we have? We have carotid triangle and muscular triangle. Which one is carotid triangle? This one is carotid triangle. We, this is the point where are both carotid vessels, you know, ECA, ECA and CCA are originated here only. You can just, I'll explain to you again, okay, don't worry. Around here our CCA is divided into ECA and ICA and all, right? So this is our muscular triangle where we have our muscles on neck, basically thyroid, is, uh, from thyroid to hyoid, cricoid, and all these neck muscles. We will discuss them only. The infrared muscle, infrared muscles are basically present here only. That's why these four are these four are anterior triangle, right? In the posterior triangle, we have only two triangles. This is our occipital bone below it, occipital triangle, right? And and this is just subclavian triangle, right? Or supraclavicle triangle, we can say, but just subclavian triangle. So these two are constitute into a posterior part of triangle, okay? Posterior triangle basically. So let's just again revise it. You can, remember this only, but we can also revise it again in this section, okay? So it is more explainable here. This part, no, let's just make it thick one like this. This is inferior border of mandible, hyoid bone, right? And this is a clavicle, and this is a sternum. Okay, so with sternum we have a biggest muscle. Okay, so this is a sternocleidomastoid. Let me increase the thickness. Okay, sternocleidomastoid muscle. This one is digastric. right? This is omohyoid, right? This is trapezius. So when you ask me to rule out all of the triangle, this is how I'm going to do it. This much is subclavian triangle. This is omohyoid, right? And then this one is occipital triangle, right? And this one is muscular. And this one is carotid triangle. You can even see the carotid here, right? This one is carotid triangle. And this one is digastric triangle, right? And this small one is mental, submental triangle. Just below are, see this part only. Mental triangle is the only triangle which is single in number but divided in both of the sides. It is present continually on both of the sides, bilaterally actually. It just all of them are present bilaterally, but it is someone which is one in number. The rest of the triangle are two in number, but this is the only one who is one in number because it's spread across the cross line. Okay, so here we will discuss the bound. We can name out all the boundaries very easily, right? It is very easy now. So if they ask you the boundaries of the triangle, any triangle, for example, they say submental triangle. Submental triangle is lined by superiorly by inferior border mandible, inferiorly by hyoid bone, and on the both side by anterior valley of digastric. What about occipital triangle? Posteriorly by trapezius, inferiorly by omohyoid, anteriorly by SCM, and superiorly by occipital bone. So carotid triangle, superiorly by posterior valley of digastric, anteriorly by anterior valley of omohyoid, posteriorly by sternocleidomastoid. Okay. What about this? What about muscular triangle? Anteriorly midline, posteriorly omohyoid, and then SCM, and inferiorly by SCM. Right. What about this one? Superiorly by inferior border of mandible, posteriorly by posterior valley of digastric, inferiorly by hyoid bone, anteriorly by anterior valley of digastric. So it's that easy. Okay. You don't have to bother early. Now, what they also ask you, what are the content of the triangle, which you can even name on your own, but if still bother you, let's just discuss it. Okay. So now we have two things. So when we view the triangle as two part, right? We are viewing it in this direction, right? So this is the superior surface, basically skin, right? And this is the base, like how deep you go. Okay, it's also called a floor, right? So this is skin, this is base. So if we go from top to like from the outside to inside, so that's known as roof, right? So roof is mostly made by what is covering over it. So let me name out all of the skin color. Like below it, investing layer present, right? On the posterior triangle, there is investing layer over which what we have, over which we have our platysma muscle. Right, investing layer, which is deep cervical fascia, which is present everywhere. Above it, a investing layer, platysma muscle. Sorry. Okay, so this is investing layer, right? Below it, above it, basically, above investing layer is platysma muscle, right? Above which is a what lie above that? Superficial fascia, and above everything is a skin, right? Skin. So that's how you remember it. So let's just revise it everything in a single go. Mandible, anterior border, clavicle, and this is where a mastoid, right? Mastoid. Here is a SCM. This is trapezius. Hide bone, right? And this is where a omohyoid is present, right? So what are all the triangle? Another muscle left, digastric muscle. This is digastric muscle. So this is a mental triangle, submental triangle. This is digastric triangle. This is muscular triangle. This is carotid triangle, right? This is suboccipital triangle, and this is subclavian triangle. Easy. So what are the layers, right? So layers. What all layers are present? If you remove this part, if you remove this skin, right? So you cut open the skin, right? You can just cut open the skin below which you will have to remove fascia, say this is the superficial fascia, below which you will have to remove platysma muscle, below which you will find investing layer of deep cervical fascia. After that, you will be able to find out triangle, right? And below which you will have base of the triangle, which is made by muscles. This is our posterior triangle. Which muscle? What are the muscles in posterior triangles? In which it is made by splenus, capitis, levator, scapula. Don't worry, we'll discuss that how to remember these. Okay, don't worry. Posterior splenus, middle splenus, anterior splenus. Right? Let's remember them again. This is a SCN, right? Trapezius omohyoid. So how these muscles are? So from the below you will have scalenus anterior, right? This is your scalenus anterior. Just what they are kind of vertically aligned. Below, before, after that, you will have middle scalenus or scalenus middle of, and then you will have scalenus posterior. This part is scalenus posterior. After which you will have another muscle which is levator. scapulae. Which one is levator scapulae? If it's going back to the, just behind that, if you continue this, behind that you will have scapula. Scapula is the bone at the back of your shoulder, right? So it's levator means it's pull up, right? So it's going back to your scapula, and after which you will have splenus capitis, right? So this is splenus capitis, right? This is levator scapulae, and then you will have your posterior splenus. All these three are splenus only, right? Then you just have to go from bottom, anterior, then middle, then posterior, right? So then you have triangle, and then above the triangle, this is the base of the triangle. These muscles are base of the triangle. After which you will have triangle. After which you will have what? Investing layer. Then what after investing layer? After investing layer, like there is investing layer, right? And then when you just go above the investing layer, you will have your platysma muscle, right? This is platysma muscle. Then you have your superficial fascia, and then you have your skin. So these are all the this is how all your triangles are aligned. This is your posterior triangles, right? So now you're done with the floor and all. So we will just go through by the content, which is the most easiest part, right? So what all we have in our posterior triangles? In our posterior triangles, we have certain nerves. Posterior triangles, we have nerves. Which one? You can just remember it as spinal accessory, plexus, cervical plexus. Let me do it in a mnemonic kind of thing, okay? So from A to is accessory spinal, B brachial plexus, C cervical plexus, D dorsal scapular plate. And after ABC there is PT, P for phrenic, and T for thoracic, which is long thoracic, right? So what are the nerves of the posterior triangle? A, B, C, D, P, T, right? After which, what are the arteries present, right? Then arteries, three arteries: subclavian and suprascapular, right? And 40, you have transverse cervical artery, A, B, C, D, P, T, S, T. And for vein, it is only one: external jugular vein, right? And lymph nodes are very easy. Occipital triangle, so they are occipital lymph nodes, supraclavicle or subclavian triangle, then supraclavicular lymph nodes, right? So these are all the content of triangles of the posterior triangles of the neck. You know, Only important factor you just remember is SSD is very necessary and external jugular vein. These must be preserved while doing any surgery on the posterior triangle of neck. These are very important. Then for anterior triangle, we have done like we have the simple, base, made of muscles, right? Roof is basically mean, which is made by skin superficial facial investing layer. Same for anterior. What are the roof? Same skin, then you will have superficial fascia, then you will have platysma, then you will have investing. Any SSPI. Or you can just go from SPI in a decreasing order of your letter, like latest, like the most initial one is investing, then P for platysma, then S for skin and superficial fascia. So we have done with the right. So let's just discuss the content of the triangles in anterior triangle, right? So first we have submental triangle. So what do we have in submental triangle? Roof and floor borders we have already discussed. They're very easy, right? So content is basically left. In this we have anterior jugular and submental lymph node. Very easy. Only two things. Anterior jugular vein and submental lymph node. Right? In a submandible triangle or digastric triangle, submandible or digastric triangle, what do we have? It is very easy. It is pair, but they are only a certain part of submandible lymph nodes. Basically, mean you have to remember that submandible lymph nodes. Okay, and lingual artery, which is very important concern if you're going to doing any surgery, especially if you're doing surgery for submandibular gland. You have to make sure to preserve lingual artery. It's very easy to damage it. It's very easy. You can start it, and if you're not aware of your anatomy, you will going to damage it, and you have to preserve that, right? This, if they ask you the content, you can also write submandible gland, and you can also write inferior parotid gland, yani inferior part of parotid gland. So let's just make your table line. It will be the easy job. How do you remember what all content are present in your submandible gland? You have arteries. For arteries, we have facial, sublingual, and submental also, right? Veins, same. Arteries and veins are same. Facial artery and facial vein. Sublingual artery, sublingual vein. Submental artery, submental vein. Nerves, mylohyoid and hypoglossal nerve. Both of the nerve must be preserved. And structure or glands, submendy, a portion of parotid and submendy lymph node. These are salivary gland, right? So you need to remember all of these things. These are very easy. FS, right? And though you don't even need mnemonics for this. Okay. So then we have another important triangle, carotid triangle. What do we have in carotid triangle? carotid triangle, there's a lot of things present in your carotid. It is the most important triangle you can say. For arteries, what do we have? What all the arteries are present here? Common carotid arteries, internal carotid arteries, and external carotid arteries and its branches. Right? For veins, what do you have? Internal jugular vein, common facial vein, lingual vein, right? Then superior thyroid vein, middle thyroid vein, right? Jugular, common, facial, lingual, superior thyroid, middle thyroid, right? Then after which you will have nerves, two important now here. Vagus, which is 10th cranial nerve. You don't mess with this, right? If you mess with it, you will mess with your heart. Spinal accessory, 11th cranial nerve, very important. Ansa cervicalis. We will learn about this in when we will discuss the plexus, okay? And sympathetic terms, sympathetic trunks, right? Then two important structure, larynx and thyroid gland. This is the one of the most important triangle. Submandible triangle and carotid triangle are very much. You should not ignore them. Then we have muscular triangle. Muscular triangle, which is what all we have. Arteries for that we have superior thyroid. Vein for vein you have inferior thyroid and anterior jugular vein. For now you have ansa cervicalis because you originate from there and this pass through from your muscular and to carotid. Okay. Muscles, since it's a muscular triangle, but all the muscles are present here. Sternohyoid, very easy. Thyroid and thyroid, all the infrared muscle, okay? Then you have certain structures in it. Thyroid gland, parathyroid gland, larynx, and esophagus, right? So these are all the content of triangles of the neck. Okay guys, I hope it is clear and if you still have doubt you can always contact me on the given information. Thank you very much. We will meet again.